Well, good morning, everyone. This is Keith with Positively Osceola. Here we are this morning in beautiful downtown St. Cloud for another one of our Coffee Talk lives. And not just another one, we are with Orlando Health St. Cloud Hospital breast cancer surgeon, Sara Ardila. How are you today?
I'm doing well this morning. Thank you for having me.
I love it. We have actually spoken before.
Yes.
And it was a huge success. Lots of folks wanted to know more about you. And the fact is, what you do, you're doing right here in St. Cloud for us. And so what a great thing to be able to talk to you again and welcome you. And it is so darn early, isn't it?
It is, but it's beautiful outside.
It is.
Beautiful weather.
It is. I was kind of worried because it was a little misty in the morning. That's all moved away. So I really want to turn this over to you, to be honest with you. Again, we thank you for taking time. I know you're super busy. So you have been in the St. Cloud area at Orlando Health, St. Cloud Hospital, you said since September,
yes,
correct?
Yes, that's correct.
So why don't you let people know what your practice is here, what you're doing, and I know we should talk about the 3D mammography as well, if we could.
Of
course.
course.
Okay? So I'm going to turn it over to you.
So just in my background, I'm a general surgeon trained, and I specialize in breast cancer surgery. So I did a special training in how to treat breast cancer. So I'm part of a multidisciplinary team, and we manage breast cancer along with other specialists like medical oncologists and radiation oncologists as well. And I've been very happy here in St. Cloud. I've really gotten to know the community, and I hope to be here for a long time.
We want you here a long time, for sure. And so, this is a big thing for a community that's growing as rapidly as we are here in St. Cloud, for sure. Years past, people would have to travel to get that kind of service. But now it's much more centered here, obviously.
Yes.
And as we all know, driving anywhere in the Central Florida region can be somewhat of a challenge in the morning, which we were discussing earlier. But are you speaking to people? Are you finding that the patients that you're taking on are really just really grateful that they can take care of this right in their own home areas? Is that something you're seeing?
Oh, absolutely. They've been, very grateful that they don't have to travel, for over, 30, 40 minutes, and that they can get most of their care here in St. Cloud, minutes away from their home.
Right, that's a big deal.
Yes.
So now one of the things that, Brian Wetzel, the CEO, president of Orlando Health St. Cloud Hospital, we've discussed this. The hospital has been surging in growth for sure, as the county has, St. Cloud has, and we one of the additions is the 3D mammography. Could you kind of give us an idea, rundown of what that does for folks in this area?
Yes, of course. So 3D mammography is a newer technology. Before, or we still do, something called 2D mammography, where it's just two pictures of the breast. It's as if they're taking two x-rays of the breast. But 3D mammography is when they take multiple pictures of the breast and they can form a 3D picture and be able to fully visualize and examine the breast better.
Right.
And this is really great technology because now they're able to see multiple layers of the breast,
right,
and they're able to catch abnormalities easier.
And earlier?
And earlier, awesome. That's right. So having a 3D mammography leads to the higher detection rates, and also it also leads to less callbacks. So sometimes when a woman gets a screening mammography, if they find something, the radiologist calls them back to get something called a diagnostic mammogram to further analyze the abnormality that they found. But with a 3D mammography, they have shown that it decreases the amount of callbacks, which is good for the patient as well.
So tell me, how did you choose this area of practice? Okay, so what was that trigger for you to say, okay, of all the options I have, this is the area I want, this is the area I can make the most difference? How did you make that decision?
Throughout my training, I've always been, found a lot of meaningful relationships and experiences while taking care of women.
Right.
So I've always really enjoyed women's health. And then it wasn't until my training, my surgical training, that I started working with cancer patients.
Right.
And so being able to take care of women that are going through breast cancer is, and somehow impacting them throughout this difficult time is really meaningful to me. To be able to be part of their journey, I guess, and make it as easy as possible. And also, you know, if caught early, they do really well. So that's what I like to tell them. You know, get your mammograms, and if caught early, we're gonna treat this.
I think what I've noticed as well, and we get to speak to a lot of different physicians in different areas of practice, and I always, it almost always seems to line up with their personality. A very caring, gentle kind of a personality seems to line up with this kind of area of practice, because there's so much more than the medical side. There's always that caring side and that human side, and I think I see that in you. So are you finding that the patients, I know I already know the answer to this, patients are really loving that you're here because they feel very comfortable with you. So is that what your personality lines up with as well?
I appreciate
that. Hard to
that.
take a compliment, right?
No, I appreciate that. I think that I've been forming very, you know, special relationships here in St. Cloud. I mean, unfortunately, they are coming to my office to meet me in difficult times, but I'm having really special relationships with my patients.
Love it. So this is St. Cloud, certainly a rapidly growing area, as I referenced earlier, but this is not Orlando, and so we're really grateful that you're in our small town. You know, St. Cloud is growing, like I said, but it still has that core feeling of being a small town. Orlando Health, St. Cloud Hospital is our hometown community hospital, and you're part of that. So what was the choice of, you know, I think I'm going to go to a smaller area. I'm not going to go to Orlando as an example. What triggered that? What made you make that decision? Because we're glad you did.
I'm very glad I did as well. You know, prior to starting here, I did know St. Cloud. My family lives here. My mother lives here. So I was familiar with the community, and being, you know, coming from a Hispanic background, I'm Colombian and I speak Spanish, I really wanted to be able to serve a large portion of the Hispanic population, which we have here.
That's a big deal. I mean, more, I think it's above 50%. I think it's almost 60% of the folks in Osceola County are of Hispanic origin, so, and certainly speak Spanish. So we enjoy that as well. I think for us, my wife and I have always said, we think the diversity in our county is the richness and the power of our county, really. I think that's why we're so, I mean, I love the diversity. So for those folks who are not sure of what is generally suggested as proper screening, why don't you give us a little bit of that information, how often and how that can take place? Of
course. So it's recommended to do a screening mammogram every year, and usually the primary care physician, or, you know, the family medicine physician, internal medicine, or OBGYN, whoever's taking care of you and doing your annual checks, usually you can ask that person to order the screening mammogram for you and at least get that started. Now, 3D mammograms, we're very lucky that we have it here now in St. Cloud, but it does vary. Not all breast imaging centers have it. Orlando Health does have it here now. So that's something that you want to check. And also, some insurances may or may not cover it. So that's something that you want to check with your insurance plan as well.
Always a wise move. So are you still accepting patients right now?
Absolutely, yes. I see anything related to the breast. So whether that's, you know, any benign breast disease and also breast cancer.
Awesome.
Yeah, so they can, you know, if any questions at all, they can call my office.
Awesome.
But I do want to go ahead and say just a quick reminder, we're, you know, the beginning of 2026, and I know Breast Cancer Awareness Month is technically in October. But for 2026, it's estimated that about just under 322,000 women are going to be diagnosed with breast cancer, and about 2,600 male are going to be diagnosed with breast cancer. So the first step is getting that screening mammogram. And if you haven't gotten it this year, if you're due, call, get it scheduled. And if you have a friend that you can check on them, that way, you know, it gets that effect going. And to quote our president of St. Cloud, Brian Wetzel, breast cancer awareness is every day, not just October.
Yeah, that's the deal. I think that's why we're
Yeah.
sitting here right now, correct? I mean, it's nice. Honestly, it's nice to sit here with you right now. You're fun and you're super knowledgeable, and honestly, we're very glad you're part of the system here. But in reality, this is a very serious life scenario, and I think sometimes we live in this time. We're all busy. I'm the same thing. We're all so busy all the
Yes.
time that gets pushed another month, another 2 months, another 6 months, a year, and we're not taking care of those things. Early detection is paramount, right?
Yes.
In everything.
Yes.
Ironically, I mentioned I have my annual exam today
Yes,
with my doctor over at St. Cloud Hospital, Orlando Health St. Cloud Hospital, and I'm grateful for that right in my neighborhood. So we're super glad you're here.
Thank you, Keith. Thank you for having me.
Absolutely. So again, this was a very special Coffee Talk Live because it is about life and about preparedness and being prepared and early detection. So please take that serious today. Certainly, we're all smiles, but it's super important to do that for you and for your family. It's super important. So again, we thank you for your time today.
Thank you, Keith. Thank you for having me.
Got it. All right. Again, this is Keith with Positively Osceola, along with Orlando Health St. Cloud Hospital breast cancer surgeon, Miss Sara Ardila, together making a positive difference in and around Osceola County. Thanks, everybody.